Welcome back to ABC-7 at 4. We've heard a lot about the variants of the coronavirus, so how many are there and are the vaccines effective against them? With the answer to those questions, we welcome in Dr. Neha Sharma. She's the medical director of the hospitals of Providence, Northeast, and Horizon City. Dr. Sharma, as always, a pleasure to have you on the show. First of all, why should we be concerned about these variants?
The CDC, Mark, is currently monitoring multiple variants in at least 33 states, and there are at least 500 cases and counting. Why should we be concerned? Because it seems like these variants are more contagious or more easily transmissible than your standard strain. And it looks like that by spring, it may become even more dominant in the United States.
Now, do the variants cause a more severe illness or a higher death rate?
So far, the studies are revealing that they do not, and even the clinical manifestations are the same.
All right, so how many variants are there, and are there any in Texas?
There are at least 3, actually even 4. There's a 4th variant currently being monitored and studied in California. And the other 3 are the UK variant, the South African variant, and the Brazilian variant. Are these in Texas? Yes, they are. The UK variant was confirmed way back in January. The South African one was confirmed a couple of days ago, and experts say that the Brazilian variant also may be here already. In the borderland, however, there are no confirmed cases of these variants. But again, like you and I were talking earlier, Mark, these variants do not wear a name tag. So the only way to know if you are infected with a variant is to study the sample in a lab.
All right, that was a question that I was wondering about. It's like, how do you tell? It's, you know, it doesn't wear a name tag. So, all right,
Exactly.
So is the vaccine effective against the variants?
Short answer is that yes, they are. But let's talk about the vaccines a little bit. There are some vaccines like the measles that you don't have to change at all. They just work. But other vaccines like the flu vaccine, you have to change every year based on the circulating strain. Now, with the COVID vaccine, so far the studies and the data reveal that they are effective, but some strains may prove to be problematic, like the South African one. But the good news is that if there is a problem with vaccine efficacy, these vaccines can be modified very quickly, and the FDA already has a plan regarding that.
Now, some of our viewers may be wondering if you've already had COVID-19, can you get the new variant?
It's safe to assume that reinfection is possible, yes. So if you had COVID, the natural immunity is not optimal. So I'm going to once again emphasize the vaccination. Please get it for optimal immunity.
And how can we prevent the spread of these variants?
If you got your COVID vaccine, please do not abandon preventive strategies. You can still get and spread COVID-19. And with the variants too, please continue to practice social distancing, wash your hands, and wear a mask.
Some good advice as always. Dr. Neha Sharma, medical director of the hospitals at Providence, Northeast, and Horizon City. As always, thanks for your time.
Thank you, Mark.